Hey guys, so I've come back with another experience to tell you what I learned today since I'm here in Orlando, Florida doing my clinicals placement here in Orlando, Florida. So basically today I happen to work with a wound nurse. Yeah, wound nursing is another department entirely. So basically, I would say when you want to do your wound dressing, so I basically did some wound dressings today. When you want to do your wound dressings, first of all, you have to check your doctor's order to make sure that you know what you're doing, to know the kind of treatment required for the patient's wound dressing. Of course, you have to gather your supplies and then you perform your hand hygiene, and also make sure you got your gloves on. I even went as far as wearing two gloves. I know you really don't have to do that. One glove is fine. And then if the patient can verbalize, you have to ask them their name and date of birth to be sure that you're dealing with the right patient. But if the patient cannot verbally tell you their name, then you can now make sure you check for their handbands to be sure it tallies with the doctor's order, whatever information you gather, like name, first name, last name, date of birth, room number, and all of you. So basically, after you've done all of that, you of course you introduce yourself to the patient and tell the patient what you're here to do. You know, your name is this, I'm a student nurse, I'm here to actually dress your wound, if that's okay. Of course, a nurse will accompany you, while you do that. And then you have to take off the patient. Of course, you prep the place and put the necessary things there if the patient is bed bound, to make sure that you don't wet the patient's bed, because if you do that you have to change all of it. So you just prep the place and put your protector on the patient's bed. If you have to, get your supplies close to you. Of course, you perform your hand hygiene because you're dealing with wound, and then you take off the bandage or whatever is wrapped on it. You take it off and then you access the patient's wound. And now, what do you access for? Sometimes, in some cases, depends on the kind of wound, but in most cases, you can access for bleeding, you can access for infection, you can access for swelling. You understand what I mean? Mucus, you just access for drainage, stuffs like that. But there are also systemic infection which you can actually get by checking the patient temperature or asking the patient their pain level if they feel pains in that area as well. So basically, it was fun actually, and sometimes you discover that the patient's wound has a oozing odor and all of that. It's still part of the job. You got to do what you got to do, right? So basically, those are the processes. I might not name them in the correct process, but make sure you do these things and make sure you disinfect the patient's wound when you're dressing the wound. Disinfect, you clean properly. When you clean the patient's wound properly in the correct order, and then you use the correct medicine required for that patient, not use someone else's medicine for another person. You do what the doctor has ordered. You have to always check doctor's order and make sure that you do the correct thing when you're dressing the patient's wound. Then after that, another very important thing is you're not just going to leave there, take off your gloves and throw them away. No, when you're taking off your gloves, take them off in the correct order so you don't touch yourself and get your uniforms or your body contaminated. So you got to take it off appropriately, and then you wash your hands. You have to wash your hands again, and then you take your supplies. I would wash my hands before I put on another gloves, then take my supplies, because I don't want to use the same drainage hand that I used to dress the patient's wound and touch the patient's wounds and surroundings to pick up my supplies again. I will take those gloves off, wash my hands, perform my proper hand hygiene. Of course, that's washing of hands. Then put on another glove, take my supplies back to my cart. when I take my supplies back to my cart, if you want to double check if you did the right thing, fine, there's no harm in doing that. But if you don't want to do that, of course you have to sanitize your materials that you use for this patient, because you're moving from one place to the other. You don't want to take up infection from the supplies, scissors, stuffs that you use, forceps, things that you use for the patient, and then take it to another patient's room and use it. That is not right. That means you're transferring infection from one patient to the other. So you make sure you have to clean your supplies again. So this is what I actually learned today as part of my clinical experience today. I did wound dressing, and then I also help with other things as well, but basically this is what I learned, and I hope this helps someone. It's actually fun. Like I always say, try as much as possible to enjoy what you're doing. I like to enjoy what I'm doing. Even though I've not done it before, I just had fun into it and make sure that I do it the right way and enjoy it. If I make mistakes, I correct my mistakes. Nobody is born a nurse, a good nurse, the same one day, Practice make perfect. But basically, I think we're learning a lot. Yeah, I'm learning a lot personally. Yeah, so thank you very much and do have a wonderful day. Bye-bye.